have to
Papillary
know
muscle?
the papillary muscles,
So papillary muscles are the bigger pieces like that right there.
with the valves and everything, and like that's it.
What was the pulmonary? Did you just say the pulmonary trunk?
Pulmonary trunk is kind of missing on these.
It's like where you
one
think
that goes
the
across.
atrium would be,
Yeah.
and then in front of it.
And so, but it's not really here on that.
Okay.
So aorta,
Okay.
superior and inferior vena cava. Heart would sit upright like this. So superior is where my knuckle is. Inferior is where my finger comes out. If this was labeled, there would be a stick going through like this. If the sticker's on the top, superior, the sticker's coming out the bottom, inferior. I won't just like put a pin. It'll actually be labeled like so. So you'd actually be able to see it. And then, I don't know really what's inside the heart so much, but again, the chordae tendineae are the thin ones, the papillary muscles are the big finger-like that you see inside, deep. The myocardium is this thick, the stuff that looks like steak. It's actual muscle. That's what myocardium is. What is the other?
The pericardium and
The
then
outer
the endo.
endocardium is
like this.
inside. So it's the shiny inside is endo. That would be more question, as like what's the outside tissue called?
You wouldn't like
No, because if there's a pin, it's probably going to ask you left atrium, right atrium, or left ventricle, right ventricle, left atrium, right atrium, and then the different vessels right there.
Okay.
So, is there anything else?
wasn't.
I mean, the valves are kind of torn up. The valves will be more on the models than in here, because
Do we need to know the interventricular sulcus?
can I see it?
Yeah, there were some like
Maybe, like, right in the
bolded terms that.
So I
That
think that's
Myers
going to
is
be
like
more of
another
a, again, like you need to know that the divider between them is interventricular sulcus, but like as far as being able to identify where it is, it's that wall right there between the two, but you can't tell that's what I'd be pointing at. So no. And then here, oh, so that part, yes, because it's that groove.
What part?
So that's the interventricular sulcus on the outside.
Just the.
So that there's a groove right there, and that's really easy. Probably, if it's labeled, it would say groove or line as far as identify. Always be aware that if you have to ask, like, what are you pointing at? Ask whoever your proctor is for the exam, because if it's pointing and you not sure, it's a bad, it's always hard to miss because you don't know what it's pointing at. So right ventricle, left ventricle sulcus, the apex is easy. Parietal pericardium is removed. Pulmonary trunk, what's left of it, is right there. Somebody with hands, I don't know what else matters. Really awkward videos.
I know more.
All right, so yeah. So that's really it. That's all you need to know. The pulmonary valves, I mean, know the valves on the other ones. I mean, I can point and
mitral
say
valve
it's
and
right through
tricuspid
there.
and-
It's just
but,
like hard to like place something.
yeah, I won't be able to
Ends,
do.
yeah.
So yeah, I mean, the chordae tendineae are easy to label. The papillary muscles are easy to label. The myocardium is easy to label. The atria are really easy. All the veins and arteries, obviously, are going to be easy because you can put sticks and pins into them and say what they're at. So that's all of it.
Thank you.